Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, good morning, good morning, good morning. Welcome everybody to the CATHIP Health Hour. I'm so glad to see everybody after such a long time. My name is Dr. Aya, and I'm looking forward to a fantastic session today. So I hope you have your coffee or your Milo or your hot chocolates or your pap, whatever is going to make you more comfortable. We have an exciting guest today. Our guest is an expert and somebody who's going to be giving us her knowledge. She is Dr. Joyce Ameh, and she is a GP who has a special interest in women's health and is an expert in the menopause. So without further ado, I want to say thank you and welcome, Dr. Joyce. Please take it away.
Well, thank you very much. Thank you very much, Dr. Ayo. Thank you so much, Khan, for giving me the opportunity to talk about a topic that I'm very passionate about. I'm passionate about most things to do with women's health, and menopause happens to be one. I am a menopause specialist doctor as well as an NHS GP at the moment. But I've been asked by Khan to talk about keeping your cool in the menopause. Keeping your cool in the menopause. And I thought about it in two different ways. I thought about it keeping your cool physically and mentally. So those are the two aspects we'll be talking about today in this morning's session. So let me look at get my slides up. Are my slides apparent? Can everybody see my slides?
I think we're just waiting for them to load.
Can you see them now?
It's not coming on at the moment. If you don't mind trying again, and I'll just have it ready on my side. Yeah.
There you go. It says your screen sharing is paused. How do I unpause it?
It shouldn't say that, but I'll just share it on my side for you. Just bear with me.
while we're waiting for the slides, especially because of our special guest, Dr. Ameh, I want to take the opportunity. Next week on Friday is International Women's Day. Everybody who was alive today has passed through the legs of a woman, and we want to say happy International Women's Day on behalf of Khan to all the women who are listening to this or watching this. As your brothers and husbands and sons, we love you. We appreciate you. Happy International Women's Day in advance.
Dr. Joyce, can you see my screen?
I can see, I don't know whether it's your screen, but I can see my slides.
Yeah, that's fine. Yeah, I've got the slides up for you. So you just proceed and I'll just go through the slides. When you're ready, just let me know. Let's go to the next slide.
So are we at the beginning of the slides? Are we on the first slide?
Yes, we are.
Okay, sorry about that. Technology, I'm not great in technology, so apologies for that. So yeah, this is me. I'm Dr. Joyce Ameh. I'm an NHS GP, menopause specialist doctor. I work for the online specialist clinic, and I'm also a lifestyle physician. And I've been asked to talk about keeping your cool in the menopause. Next slide, please. So why are we talking about keeping your cool in the menopause? And interestingly, what Dr. Ayo said a few minutes ago about we've all passed through the legs of a woman, that is very true. Most of us women will go through the menopause or have gone through the menopause or will go through it in the future. It's so important for us to learn about the menopause at all aspects of your season. If you are below 40, it's something to look forward to. If you're less than 55 but above 40, you're probably going through something right now. That's the perimenopause. And if you're above 55, hopefully, you should have gone through it. And then you can use your experiences to encourage other women and also learn about your own health. So learning about others' experiences, what worked for them, what didn't work for them is so important. And it can also help to ease your symptoms. There's a lot of talk about the menopause right now. It is a very topical issue. But for our own self, our own health, especially as African and Caribbean women, we should know how to best improve our health during this season of our life. Next slide, please. And why now? Why is everybody talking about the menopause? Because as far as I know, women have always gone through the menopause. It's not new. It's not that all of a sudden it's been invented or discovered. We've always gone through the menopause, as long as there's been women. But it's because we are living longer now. In the 1930s, a Black female woman would live to the age of 49. She lived a very hard life. And so she would pass away while she was in the perimenopause or just about to start the menopause. A white woman would live a little bit longer. But now, this is a stat for over 10 years ago, so it may be even better now. A Black African woman or even a Black Caribbean woman, they do live into their 80s. White women also into their 80s. So we would live half of our lives in the menopause or having passed through the menopause. So that's why it's so important now to maximize your health and to understand the topic of the menopause better so that you can improve your years in the twilight years of your life. So important now. It's also, as I mentioned before, quite a topical issue. I don't know whether you heard in the news recently about menopause in the workplace. Employers are supposed to make reasonable adjustments now for women in the menopause because they've discovered that a lot of women are leaving their job because they just can't cope with the job and the menopause. And we'll talk about that in the next few slides, why it's happening and why women are feeling disempowered during the menopause years and what we can do about it. But that's why it's so important now. That's why we're talking about menopause now. And that's why menopause clinics are springing up everywhere, because women are beginning to think about taking their health back, and understanding themselves in all their seasons of life. Next slide, please. Just a second. Do I have, 1 minute. Are you looking at, am I looking at your slides or my slides?
You are looking at my slides, the slides you sent me. I'm displaying them. Yeah.
I actually can't see my slides that you are seeing, but it's okay. Let me stop share. Sorry, this is really awkward, but let me see. Now I can see. Okay, brilliant. So before we start, I think it's important for us to understand definitions. So when I say menopause, perimenopause, early menopause, premature menopause, we all understand each other. Some of these are all medical terms, but they're terms that we should all learn. And it's easy if we're all speaking with the same language. Menopause simply means the stopping of menstruation, the pausation of menstruation. And the average age is about 51, but it can be 5 years before to 5 years after. So it's a wide spectrum. Some women go early and some women go later. However, 10 years before your periods stop and stop for good, you will be experiencing some symptoms, and all women experience some symptoms from mild to severe. Severe menopausal symptoms are not common, and I want you to hold on to that information. Severe menopausal symptoms are really not common. Despite all the news, menopause is a season, and it can be dealt with naturally, but severe ones, they're not common, which is really good news. Next slide, please. So if you've not had a period and you're in the right age for 12 consecutive months, that's when we say you've gone through the change. Some people use the term the change as the menopause. So the change is when you've not had a period for 12 consecutive months. So if you've not had a period for 6 months and then you start having periods, you haven't gone through the change yet. And the menopause is simply a reduction of the female hormones. We have 3 significant hormones which dip significantly during the menopause, and that's estrogen, progesterone, and testosterone. And that's why we go through the menopause, because your hormone levels are basically in the boots. They're really, really low. In the perimenopause, so those are the 10 years before you actually stop periods, you have fluctuations. So your fluctuations in your hormones, sometimes your hormones are high, normal levels, and sometimes they're low. And that can also lead to a irregularity of your menstrual cycle. So your periods may come and go. They may be heavy, they may be light, and you might be getting some symptoms. And that's just because your hormone levels are fluctuating during that period. If you go through the menopause before the age of 45, but above 40, so if you're between 40 and 45, they would say that you've gone through the menopause early. So early menopause is when you are below 45, but above 40. But if you have gone through the menopause, and unfortunately there are women who have, before the age of 40, that there are women even in their 20s and 30s who have stopped having their periods, who have low hormone levels, and for many reasons, then we will say you've gone through premature menopause. And it's important to note that if you have gone through the menopause early, or if you've gone through it prematurely, you really should be taking some hormones, because you are lacking hormones at a very early age, and that is detrimental to your health. It's not good for your health in the future. So it's important that you seek medical advice if you've gone through the menopause early or prematurely. But if you're above the age of 45 and beyond, then you're in the normal place for menopause, so that's normal. Next slide, please. So we all know the physical symptoms of the menopause. The hot flushes, I'm going to talk about the hot flushes in some detail later. Body aches, sometimes you just wake up and for no reason your ankle aches or your knee aches, your neck aches, and let me not start talking about back aches. You become dry in places where you were initially moist, especially vaginal dryness. That area becomes quite dry and cracked and sometimes sore and more prone for infections. Some women who never had infections there before start to get a lot of vaginal infections because it's dry. You tend to lose your hair on your head. So you have thinning or balding on your head. And interestingly, you now start to grow hair in areas that you weren't growing hair. So especially your chin. Some women have what we call a peach fuzz. So lots of hair, very fine on their face, which we call peach fuzz. Sleeplessness, you find it hard to get to sleep. And then when you get to sleep, you wake up in the morning, very early in the morning, call it early morning waking. You wake up, you don't have refreshed sleep. You wake up, you don't feel as if you've slept. Headaches, women who have history of headaches, or even if they don't have a history of headaches, they tend to find that they get worse during the menopause. You get a lot of palpitations, and your periods change. So they can become heavier. Women who have fibroids, for example, they tend to be more symptomatic during this stage, or they become irregular. You have a period today and then it's disappeared and it comes back. It doesn't follow a pattern. There's a lot of things, which is why they call it the change. And there's also incontinence. And I put it down there as the last slide. And that's because it's probably one of the things that we do not talk about a lot. And wetting. Every cell, every organ in your body have receptors for estrogen and progesterone. Every cell. So we're not just talking of your womb and your ovaries and your breasts. We're talking about every single organ, every single cell. And the problem with women sometimes is because they have these dips in estrogen and progesterone, then they find that they have weakness, bladder weakness, and that can lead to incontinence. So many people are embarrassed. They don't want to tell the doctors or significant others, and they soldier on. There is treatment out there. Lots of treatment out there, actually. So do not suffer in silence. But incontinence is a symptom of the menopause, definitely. Next slide, please. Oh, more physical symptoms, sweat. So if you have a hot flush during the night, we call them night sweats. We've talked about joint and muscle pains, and be aware that menopausal women are more prone to suffer from injuries when even in the gym. Things that they were doing before, they tend to find that they get injured a lot more quicker, a lot faster when they're going through the change. We've talked about headaches. Gritty eyes, dry eyes. You may have noticed, you find that I talked about loss of moisture when I was talking about vaginal dryness, but it can even occur in your eyes. We've got estrogen receptors in your eyes as well. Tinnitus is ringing in the ears. So menopausal women sometimes complain that they can hear ringing, even though there is no ringing, it's coming from inside their ear. And that can be quite demoralizing for women as well. Thinning hair, mentioned it. Itchy skin, because your skin is dry, it becomes quite itchy. And the dreaded weight gain. Now, it's almost impossible to speak to a menopausal woman and not talk about weight gain. It occurs quickly, it occurs sometimes overnight, but it's hormonal driven, and women gain weight. And unfortunately, it's not where women prefer to gain weight, which I think that they prefer to gain weight there. It's usually in the abdomen, and they look, we call it a little bit like an orange on stick. So they will have a big stomach, almost as if they're pregnant, but they're not pregnant. Urinary frequency, urgency, so they're constantly popping to the toilet, going to pass urine. Their bladder is becoming weak, and they have a lot more bladder infections, which we call cystitis. So these are the physical symptoms of the menopause. And like I mentioned, if you remember that we have receptors of estrogen and progesterone on every organ, then virtually every organ will have a symptom of the menopause when you're going through it. Next slide, please. So if you talk to a menopausal woman and you ask what symptom are you having, majority would mention hot flushes. Majority would mention hot flushes. And what is a hot flush? A hot flush can be different for different women, but it's usually the feeling of heat, intense heat. You suddenly feel as if you're boiling. Spreads through your body, up onto your face. It could be in your hair. If you're a Caucasian woman or a light-skinned woman, you can even sometimes see it. They turn red as if they're blushing. They have real red blotches or patches on their face, on their neck, on their chest. Some women will start to sweat. You might see little beads of moisture on their upper lip. They can see patches of sweat under their armpits, at the back as well. It can affect your mood. You can sometimes lose a bit of concentration, become a little bit disoriented during it. So can you imagine if you were in a meeting and, a board meeting or whatever, you're talking to your superiors and you start to have a hot flush? It can be quite demoralizing, can affect your self-esteem. For a few minutes, you might feel a little bit dizzy. You start to feel hot. You start to sweat. You take off your clothes. It can be quite demoralizing. It can occur at any time during the day, anytime, morning, night, afternoon. It can occur any time. It lasts for a few minutes. They say the average is 4 minutes. I don't know how they time that. That's the average. Some people have it for seconds. And some women don't have them that frequently. Some women have it every hour. So think about how badly those are the severe ones, every hour. And some people get 1 or 2 a month. It might not be too much for them. It can ignite, and that's what we call hot sweats, where they wake up in the night sweating, they're soaking wet, they might have to change their clothes, change their sheets, and so on. It can be quite demoralizing, to be honest. And unfortunately, you may carry on getting them for several years after your periods stop. So stopping of periods is a sign of your menopause. You've gone through the menopause, but you might still be suffering from some of the symptoms of the menopause, especially the hot flushes, and that can occur for several years afterwards, but with reducing severity as the years go on. Next slide, please. So how does the menopause affect your mental health? Well, we already talked about how having a hot flush in a boardroom or in a meeting or, you're with your friends or whatever can be quite demoralizing, can affect your self-esteem. But the menopause itself can also affect your mental health. Menopause itself can affect your mood, your emotions. You can become quite anxious, feel quite depressed. I remember years and years ago, before now everybody's talking about hormone replacement in the menopause, I would see lots of women in their late 40s, early 50s, quite high-powered women, but coming in with symptoms of anxiety and depression. They weren't concentrating, they weren't sleeping, they had no joy, they felt unmotivated, aching all over. And to be honest, I would, at that time, I'm talking years ago, I have been a doctor for many years, I would put them on antidepressants and they would work, but they were not the treatment. But menopause can significantly affect a woman's mental health. That usually occurs at a time where other things are going in their lives. You know, it occurs in your late 40s, early 50s. Your parents are getting older. Your children are getting older. You're becoming more senior in your workplace. There's a lot of stress going on outside, external to a woman's body. And then you have your internal stresses as well going through the menopause. So it's a difficult time for women as well. Brain fog is another symptom where they just can't concentrate, or they'll read a report over and over and over again. They can't get it, and then it will lift. It's a challenging time. Next slide, please. So why does it happen? Why do you get more anxious or depressed or stressed when you're going through the menopause? I don't know, this is quite a busy slide, but it basically it's just saying, as I've said quite a few times today, that we have receptor cells for these hormones, even on the brain. And we have estrogen receptor cells, we have progesterone receptor cells. And if you are lacking, and so estrogen is meant, the benefits of estrogen, let me read what I've written there. It's good for learning, fine motor control, so good for your hand, eye control. It's good for memory. It helps with your sensitivity to pain. It's good for your coordination. And we know it helps to prevent against Alzheimer's and strokes. It's an anti-inflammatory hormone, estrogen. So you imagine if that's low, you might struggle to understand things, your learning's affected. You might struggle to write because of your fine motor. You might struggle to remember because your memory's affected, and your coordination can be affected. Progesterone, however, has quite a calming effect, quite a calming sedative effect. So in women who I prescribe this drug, progesterone, I would tell them to take it at night so they can help them to sleep. It helps with anxiety, it helps with stress, it helps with fear. So if that was low, you can imagine you'll be more anxious, won't you? You'll be more fearful, you'll be more stressed. So these are the reasons why women who are going through the menopause may have some effects on the mental health. It's not just because they are, depressed. Next slide, please. So other mental health issues, mood swings. You see a woman who's happy 1 minute and the next minute, irrationally, they may be angry. They're foggy thinking. We talked about brain fog. We talked about poor sleep. Loss of libido is one. A woman who is stressed really doesn't want to be involving herself in intercourse. She just wants to sleep, which might be a struggle as well. They become very, very irritable. I think that might be the word. The second most common symptom for women after flushing is irritability. Very irritable, sometimes for no apparent reason. Snappy, unreasonable anger. And we've talked about the loss of confidence and the low self-esteem. And that's why a lot of them are leaving their job. They're thinking that they may be going mad. They don't understand why they're feeling the way they're feeling. It can be quite a challenge. And also, if you were somebody who had symptoms of low mental health or poor mental health when you were younger, sometimes women going through the menopause, you find that it can trigger these symptoms, these conditions even further. So you have worsening of pre-existing mental health conditions. So if you had been somebody who had been depressed before, you might find that gets worse during the menopause because of the hormone changes. Next slide, please. So we've talked about all the doom and gloom. Yes, we're pretty clued up now what menopause is. I don't think I've said anything new, but we're going to talk about what can be done about it. What can be done about it? And I'm a doctor, so we will start first about what I would prescribe if a woman comes in with menopausal symptoms and she's agreeable, and that is the HRT. So look, if somebody comes and they have low iron, I would prescribe iron tablets. If you've got low vitamin D, you would get vitamin D tablets. The menopause is low estrogen and progesterone. So it stands to reason that we are replacing what we are missing, what we are deficient in. That is why we give hormone replacement therapy. Your hormones are low, so you need to top it up. It is the most effective treatment for menopausal symptoms. The most, hands on, the most effective. It helps to relieve those symptoms related to estrogen deficiency, those that we've mentioned earlier on. Some women also get progesterone, especially if you still have a womb. If you don't have a womb, you don't need to take progesterone. If you have a womb, you should. You must actually take progesterone as well. If you're taking the two hormones, it's what we call combined HRT. And you give it to women who are struggling with menopausal symptoms, with all those symptoms that we mentioned earlier on. And there are lots of benefits of taking HRT. The initial benefit is those symptoms will improve significantly. So you will sleep better, think better, move better. You don't have the sweats, don't have the infections, especially your water infections. But there are also long-term benefits of taking the HRT. You have a reduced risk of fractures. You have a reduced risk of thinning of your bones, which is called osteoporosis. And I did read a research that says that women who take the HRT do have slightly longer life. I think it's because the women who take the HRT are more in tune with their health and they have a little bit longer life. It's a few months, but it's something. So HRT is the gold standard of menopausal treatment everywhere. That's what I would prescribe. Next slide, please. And there are various forms of HRT right now. There's the new ones coming every day. You can have tablets, creams, gels, patches, sprays. It's like a sweetie shop. It depends on what you like. If you like to spray, it's a sprays. If you prefer to take a tablet, some people like taking tablets. There are tablet forms of it. It's all about discussing with your doctor or your specialist clinician what you would prefer. Get specialist advice. Definitely important. Some women don't like taking it every day, so they might need to take it on different days. There are so many regimens out there, and the best time to start taking it is not when you've gone through the menopause and been through the menopause and you think, "Oh, I like the benefits, I'll take it." No, the best time to start is when you are in the perimenopause. Remember the perimenopause, the definition, the 10 years before you actually go through the change. That's the best time to start taking HRT. There's a new drug. It's not hormonal. It's called Veoza. It's not yet been approved by the NHS, but private clinics are prescribing them. And that's for women who are suffering from sweating. We call those vasomotor symptoms. And it's for women who can't or don't want to take the HRT. Okay, so there is a drug out there which is not hormonal, which can help with the flushing, but maybe not help with the other symptoms, but at least with your flushing. So that's the first thing, HRT. That's the gold standard. But it doesn't have to be HRT. I'm by no means a pusher of hormonal treatment. It should be individualized. There are women who don't want to take it and who can't take it for medical reasons. There are so many reasons why a woman will decide not to take the HRT. And it tends to be the Black and Caribbean women tend to be lower down. They don't like taking medication anyway, and HRT is another medication. So talking to women about the HRT is really, really important, but you don't have to take it. By no means important that you have to take it. There are other drugs, there are other ways that we can manage the HRT and manage the menopause, without taking HRT. I think that's so important. But speak to your doctors, because some people think that they can't take it, but actually they can. There are very, very few reasons why a woman cannot take HRT. So speak to your doctors and get good advice. Next slide. Next slide, please. So not everybody can take HRT or want to take HRT, but everybody can look at their lifestyle. Now, I've been on this platform talking about lifestyle a couple of times. So if you've heard me speak about this, then apologies, but I sing it every day. Your lifestyle can make immeasurable impact on your health. It can help the season of the menopause. It can make it a lot easier, really, if you look at what you're eating and how you are living. And it can also help to improve your heart health and your bone health as well without taking HRT. And my advice would be to eat the colors of the rainbow. Eat as many colors on your plate. Orange, red, green, white. Our food tends to be very beige, but if you're eating a variety of colors, then you're probably eating lots of fruits and lots of vegetables. Make that your mainstay. Lots of fruit, lots of vegetables, various colors. Get at least 5 different colors on your plate. And eat vegetables with every meal. Vegetables with every single meal. Increase your intake of calcium-rich foods. So I'm talking about things like milk, if you can take dairy. Even your non-dairy milks are great. Kale, cheese, okra, increase that. That will definitely help your bone health and your heart health. We've talked about the fruits and vegetables. And then reduce your intake of your carbohydrates. This is my advice. Eat more low carbohydrate foods that give you a nice steady release of insulin rather than spiking insulin that you get with high carbohydrates, high glycemic index foods. So things like whole grain breads, things like brown rice, pulses. They're really good. They're low in the glycemic index, and they help to steady release of insulin rather than the spikes. Because sometimes you find that when you have a spike, you have a hot flush. You got to look at that. Sometimes you eat a meal and then all of a sudden you're sweating. Look at what you've eaten. Insulin can sometimes affect your menopausal symptoms. So it's so important to have a look at that and have some protein with every meal. And you can have any protein: yogurt, eggs, fish, beans, nuts, and seeds. Look at your lifestyle. That's so important. And that can help. And that's without taking HRT. Whether you're taking HRT or not, you can make changes to your health. Next slide, please. Also, if you're smoking, I would advise you to stop. We know that smoking women have worse menopausal symptoms, especially hot flushes. I don't know why, but they do. So stop smoking. Incorporate regular exercise that will help your bone health as well. Walking, cycling, skipping, it helps to release endorphins, which is good for your brain health as well as your body, can boost your mood. Reduce your alcohol intake. Especially if you notice that when you have a glass of wine, you have a hot flush. So women have found that once you have a glass of wine, all of a sudden they feel hot. Cut it out, cut it down. Same with spicy food. If you're the kind of woman that has spicy food, you have a hot flush, cut it down. You have to be the doctor for yourself. Know what triggers your flushes or what triggers your symptoms. And it might not be the same for your best friend, but you have to know what's right for you. Practical things that you could do, that if you're a woman of a certain age, is wear layers. Wear multiple layers so that when you're feeling hot, a layer can come off without you exposing yourself. And then when you cool down, a layer can come back on. It sounds easy, but so women like to wear one thick layer and that's it. If they're hot, there's nothing they can do. But wear layers, little light layers, multiple layers, and consider looking at fabrics that can breathe. Cotton, linen are really good breathable fabrics, not so much polyester. I've heard about deep breathing. When you're feeling that a hot flush is coming, you start to breathe in. I'm not an expert in deep breathing. You might need to look into that. But breathing in deeply helps to trigger your vagus nerve, which is a parasympathetic system, which is against anxiety. Let's just put it that way. It helps to calm you down, and it helps with your hot flushes as well. Deep breathing. Look into that if that's interesting. It costs you nothing to do some deep breathing. So I would suggest you look into that. Keeping your room cool. Yeah, that makes sense. If your room is cool, you have a less chance of feeling heated. Using a fan, either you carry one with you or have a standing fan in your office or a table fan in your office. You can put it on and off. That helps you to cool down. And drinking, I haven't put it there, but having a glass of cool water at all times so that you can have a drink that can cool you down as well from the inside out. And avoiding being hot, really. So I've put down lukewarm showers, but some people also have a hot flush if they have hot tea. So think about lukewarm showers and maybe lukewarm teas. I know I might be some people might shoot me, but yeah, just think about those things. They're quite practical things, but we will get through this. We will definitely get through this. Next slide, please. Next slide, please. And this is a time where we need to practice self-care. We need to start looking after yourselves. I mentioned earlier that the menopause for most women occurs at a time where there's a lot of external stresses. Parents are becoming older and more frail. You've got to look after them. Children are leaving the nest. You've got to worry about them. Your job, you're becoming more senior in your role. You've got to worry about that. There are so many things that a woman is contending with during this season of the menopause. So you've got to look after yourself. And that's why I put a little slide in there talking about self-care. There are so many ways in which you can look after yourself. I am a Christian, so for me, it's all about prayer and meditation and serving my God. But there are other ways in which you can practice self-care physically and even financially. Looking after yourself will definitely help your menopausal symptoms. That's why I put it there. Next slide, please. And finally, this is my last slide. I don't think, it's been quite a negative talk, but there are benefits of the menopause. There are things that, we need to look forward to. No more periods. That's got to be a good thing. The only time we don't have periods is usually when we're pregnant. So this is no more periods, no more pads. You can go into the swimming pool, saunas, without thinking about what's happening down below. That's got to be a positive. No more premenstrual symptoms or syndrome. If you are the kind of woman who gets quite moody or a little bit low before a period, you know, you get angry, you're not going to get that anymore because you're not going to have any more periods. You can have intercourse without thinking about getting pregnant. Isn't that amazing? So no need for contraception when you've gone through the menopause, not through the perimenopause, when you're sure you're not, when you're menopausal. But yeah, sex without worrying about getting pregnant has got to be a positive thing. And it helps, I think. If you are a woman who had fibroids, you know, we know that uterine fibroids are hormone driven. They're fed by hormones, and you don't have hormones, they tend to shrink after that. And you feel a little bit more self-assured during now that the menopause is over, because you don't need to worry about, oh, I'm going to have a period next week, or am I not going to have a period? When is my period coming? Have I got enough pills? You know, you have that self-assurance. It's a time to focus on caring for yourself, like I told you before. It's also a time to consider to take risks. You're now an empty nester. Your children are grown. It's you and your significant other. Think about other things, you know, think about ministry if you are a Christian. So there are definitely benefits of the menopause that we need to consider. It's not all doom and gloom. Next slide, please. Oh, any questions?
Fantastic, fantastic. Thank you so much, Dr. Joyce. I've been making some notes. That has been very informative and very comprehensive. So thank you. We do have some questions actually. As you've been talking, the chat box has been going crazy. So I am going to get the questions if you're ready. So the first question is, somebody said, I was told by my GP I couldn't receive HRT due to anxiety, as anxiety has increased my blood pressure, so I'm taking nothing at the moment. Is there anything you could suggest?
Okay, first of all, I'm not your doctor, so I'm going to speak generically. Anxiety is not a reason not to give HRT. Maybe there was some misunderstanding there, but perhaps the doctor was worried about your blood pressure and he wanted to get that down before considering HRT. So my advice would be address your blood pressure, get that down, and then consider HRT if you are keen to take it, definitely. But anxiety shouldn't be, in fact, we know that HRT users have improved anxiety because it helps with those receptors on your brain.
Fantastic. Okay, question number 2. I heard that taking HRT is for the worst kind of menopause and is not good to take after 5 years. Is this true?
So, like I mentioned, severe forms of menopause is not common, but it's all individualized. So what I might think is severe, you might think it's very mild. So, you know, so it's all individualized. If a woman is coming to me with menopausal symptoms, I would say that's quite severe. It affects her life in some way. And so HRT can be used in those women, definitely. In the past, we would tell you, so menopausal treatments, the way we're treating the menopause is changing, and it's been changing over the years as as more and more women are taking HRT. In the past, like I mentioned, I would have given a woman an antidepressant because it will come with symptoms of not sleeping, headaches, sweating, and I will give them an antidepressant, and they would work, but they would not treat the root cause. Now, then I would give them HRT. Then I started giving women lots of HRT. And initially the guidance was give them for 5 years, give them to the age of 55, and then stop. Now the guidance has also changed, and when there is no upper limit of taking HRT, if you are, you have to be assessed regularly. If you have no issues at all, there is no upper limit. I have women in their 70s taking HRT, and they are playing tennis and they are running marathons, and they're taking HRT. It helps their bone health, it helps their joint health. They are feeling wonderful. So yes, that you are right. So there was a time when they were saying 5 years. In fact, you probably still find it in some books. They will say 5 years and that's it. But in my practice, we give HRT. There is no limit now.
Fantastic. Is there a link between the age at which a mother experiences the menopause and the age at which her daughter may later go through it?
Yes, so we do know that some women who go through the menopause early, their daughters tend to go through the menopause early. I wonder if it's more to do with lifestyle. So we find that the heavier girls tend to start to have periods earlier. Don't know whether you know that, but if a girl is quite large, quite heavy, they may start having their periods in year 4, year 5, or year 6. But the slimmer girl tends to start to have periods a little bit later. The same with the menopause. Sometimes I wonder if it's not so much the genes, but it's the lifestyle of the women that's affected. But yes, if your mother went through the change early, you have got a higher chance of going through the change early. But doesn't mean you will. Just means that your chance is there.
Okay. And is there any sort of relation between the use of like HRT and weight loss or weight gain?
So interestingly, we find that women who are on the HRT lose weight because they have more energy. They're doing a lot more activities. They're more in tune with their health. A woman who's taking HRT, they've thought about it quite a bit, and so they do lose. We find that the women who are taking HRT tend to be slimmer, and the weight tends to be lower than a woman who's not.
Another question. Are there any lifestyle habits which can precipitate or delay the onset of menopause? I'm sure you've dealt with some of this in your talk already, but is there anything specifically you want to revisit?
Not the onset of menopause, I don't think. Unless we are talking about, I mean, that's going into deep. If you're a person whose BMI is very, very low, if you are anorexic, that might cause your hormone levels to drop quite significantly. And I've seen quite a lot of women who are anorexic who are not having periods, but that's not menopause. That's artificial. Amenorrhea. You're not having periods because your body weight is low. I think I mean, it's better for you to go through the menopause later than earlier. These hormones, if they're naturally produced, have so much benefits for your body. So if you can delay the menopause in some way, it will always be better. But I think God, he has your number. He has the date, not you. But healthy living right, keeping your body mass index in the normal range, cutting out smoking, these will definitely help. Definitely help you, especially in your perimenopausal phases. And a quick one about smoking. I just thought about it. I told you in one of my slides that women who smoke, they tend to have worse menopausal symptoms. They have a lot more hot flushes. We know as well that women that smoke, they go through the change earlier. So I don't know why that is. I think women who smoke are slimmer. I'm not sure. But anyway, be aware of that. Smoking is not beneficial to any woman at any stage. So that's my take on it.
Absolutely. Right. I think this is an extension of the question we asked before, but during the perimenopausal stage, how long can you stay? Can you take HRT for? I imagine it's the same as you said before. There's no upper limit if it's still beneficial to.
Yeah. We're now giving women HRT in the perimenopause and perimenopausal perimenopausal stage now anyway. So yes, you can take it for years. You're just replacing what you're missing.
Yeah.
So that's fine.
So somebody said, what about no libido during the menopause? I'm not entirely sure.
Yeah, low libido is one of the symptoms of the menopause. I think it's all to do with stress. If you're stressed, you have a hormone called cortisol that's quite high, and one of the symptoms of that is you don't feel like having sex.
So somebody's mentioned, can supplements help to reduce the symptoms of menopause?
Yeah, I am not a naturopath. Unfortunately, I'm a doctor, so I can only talk about medical things. I can talk about HRT with ease, but there are supplements out there that can help women. But I really, hand on heart, can't tell you much about what supplements I can throw them out there. You can look into them, but it's not something I've never prescribed. You don't need to prescribe supplements. So definitely as Black women, we need to make sure we're taking a vitamin D supplement, especially during the winter months. Vitamin D, our levels of vitamin D may be naturally low. We know low levels of vitamin D can affect your mood. It can also affect your bone health. So a vitamin D supplement is I would say, essential. Some people do talk about taking ashwagandha. It's a herbal remedy that helps with your anxiety. Don't know much about it. Read up about it if you want to. And then you need to be thinking about including your nuts and seeds. Pumpkin seeds, they contain what we call phytoestrogens. Linseed, they help as well to boost, and they are relatively cheap. Having a spoonful of linseed, having a spoonful of pumpkin seeds in whatever forms you can, they can also help you. But that's all I can say about that.
Yeah. So you mentioned before about, historically in your practice, a woman might have come in with these symptoms and you would have prescribed them antidepressants. So somebody's asking, could the symptoms of menopause be confused with diabetes, for instance?
No, I don't think it can. No, diabetes is quite specific, I think, and it's very easily diagnosed. So, you will have sugar, sugar in your urine and very high levels of sugar in your blood. So I don't think we will struggle to make a diagnosis, but interestingly, I have seen lots of women going through the change who are pre-diabetic. So they are not tolerating glucose loads easily. They can eat a load of glucose and they will have immediately a high spike of insulin. And sometimes that would cause a hot flush in some women. They're not diabetic, but if you do their blood, sometimes you find that they are on the way to becoming diabetic. So with these kind of women, I normally advise they need to lose weight. They need to lose weight in whichever way they can. So usually for me, it's cutting down your carbohydrate load. We're Black, we eat too much carbs, but cutting down your carbohydrate load, that would help. But no, menopause and diabetes are two separate entities.
Okay, another question. I've heard that people with breast cancer running in the family can't get HRT. Is this true?
Yes, so there are some women, especially those who have hereditary hormone-driven breast cancer, that cannot take HRT. But even those with specialist help, they may be able to take some form of HRT. Not all women. It depends on which gene they are holding, the type of breast cancer they have, and whether they have the BRCA gene, which means that their family has it. So yeah, it's easier for a GP to say, oh, you've had breast cancer, or your mother's had breast cancer. We're not giving it. But if you really dig deep, you might be able to take it. So get advice.
Yeah, okay. And specifically on that point, because obviously you're a GP, and in that situation, the patient has come to the GP and may feel like the advice that they're being given, there might be another layer to dig to. Where would you advise? Was it another conversation with a GP, or is there another advisory service to go to?
Well, it all depends on how deep your pockets are, you know. NHS GPs are just what they are, aren't we? We're just NHS GPs. We know what we know. We know a lot. We know a little about a lot. That's how I put it. We know a little about a lot. Ask a GP about something, well, you probably know something about it. But specialist doctors know a lot about a little. So all they know is that little, but they know a lot about it. If you want to get further advice, I would say speak to a menopause specialist doctor. Definitely. A GP is absolutely fine for your bog standard HRT, but if you have any kind of genetic issue that you want to be absolutely sure, because the answer might still be no, but you want to be sure, speak to a specialist doctor, because they will need to know which type of hormone which type of cancer that runs in your family, and whether you have the genes as well. And they look at so many other things. So I would say speak to a specialist doctor. And on the NHS, they do have specialists, menopause specialist doctors or nurses. They are there. There's a bit of a wait, but they are there. But privately, you could see one in 10 minutes. We're everywhere. So yeah, it all depends on how deep your pockets are.
Let's start saving up, guys. Yeah, we may need to access some private healthcare. Okay, we've got a question from our YouTube audience. Will the use of HRT delay or prolong the menopausal period? As the HRT replaces the hormones, does it defer menopause?
So that's a good question. And look, you are replacing hormones that you are lacking. So when you stop taking it, you will get some symptoms of lacking hormone. However, if it's it's going to be quite a measured reduction of your hormones. So you're not going to feel it as acutely as you did if you go through the menopause naturally, or if you had your ovaries removed by an operation and you're catapulted into the menopause then. So yes, you may get some symptoms of the menopause when you're in your 60s or 70s, but they will be very, very, very mild compared to a woman who, is going through the change in her 40s and 50s.
All right. The questions are coming thick and fast now. So I have been told that although I'm in the perimenopause, and I can still get pregnant. What are the chances of pregnancy? I've heard of pregnant women in their early 50s.
Yes. Yeah, being in the perimenopause does not stop you from getting pregnant. No. You can only not get pregnant if you are pregnant, clearly, you won't get pregnant then. But if you have gone through the change, the 12 months of not having a period, then we can say you can't get pregnant. But if you're in the perimenopause, you can get pregnant. So you need to be making sure that you are using some form of contraception. And, things are coming to me now that people are talking to me. So we do, especially for women in the menopause, in the perimenopause, could consider putting a Mirena coil in for you. So a Mirena coil is a type of intrauterine device that has the hormone progesterone. So if you have that in you, then that covers you for the contraception point of view. And then all you need to do is take estrogen as your HRT. That's a nice combination for a woman in the perimenopause, because she's got the contraceptive part, which is the coil, and she can also take the HRT, which is the estrogen. But yes, you can get pregnant during the perimenopause. And I've seen so many women being caught out because they think, oh, I'm old now, I'm 48, I can't get pregnant. Yes, you can.
Even later than 50.
Yes, yeah.
Somebody's mentioned can certain foods help? I mean, I'd probably encourage you to watch the video, but because Dr. Joyce was quite extensive with some of the advice about foods. Next question. What are the side effects of HRT?
To be honest, I don't think there are many side effects of HRT because remember, we're just replacing what you already have. So you've already got estrogen and progesterone in your body, and we're just replacing that because it's lacking. So their side effects are not massive; they're not many. But there is one that is a bit of an issue to treat, and that's bleeding. So we do find that some women who were previously not bleeding and you start giving them HRT, cells that were nice and quiet are now woken up, and you might find that you start to bleed. And some women don't like that. I talked about benefits of the menopause. Stopping a period is one of them. And then now you're having periods like, oh, I have to wear pads again. So I think the biggest side effect, not all women get it, is bleeding on the menopause. Some people, they complain of headaches, but they're very mild. The HRT is an easy drug and quite safe. Safety profile is quite good.
Okay. Does having children later, i.e. early 40s, delay menopause? This is from Zoe on YouTube.
Oh, bless you. I don't know. Don't think so. I can't imagine why. Maybe there's something out there that I don't know, but unless you've done something to have the children in your 40s, IVF, but if you're having IVF, that already tells me that something's wrong with something's going on with your hormones. Anyway, I don't know. I don't think so.
Okay. Last few questions because we have to give time to wrap up. Does peppermint oil make your hot flashes worse?
I am not aware that it does. No, peppermint oil, as far as I know, is quite calming, but I don't think so. I don't know. Some people drink peppermint tea, helps the digestion. It's not an area.
That's what I know.
It's good for gas. Is it good for gas, Dr.
Very good. Very good for gas. Very.
Really? Peppermint tea?
Peppermint. Yep. Very good. Ask anybody who's had a C-section.
Right.
Yeah. It's better than morphine. Okay. Can someone with a higher BMI take HRT?
Yes. Someone with a high BMI can take HRT, but with caution. So we will definitely go through all the side effects. We know that obesity is a risk for lots of things, blood pressure, diabetes, even cancer. Unfortunately, obesity is one of those that we talk about. So yes, you can take HRT if you are obese, but I would always say, you need to have a plan in place to lose the weight, and try and address those lifestyle measures I was talking about.
There are some questions here that I'm going to skip because I would advise everybody, this has been such an informative talk that you should probably go back and watch it on YouTube because some of these questions were answered already. I've stopped my period for 2 years. I have a Mirena coil and I have very little symptoms. I'm 52. Have I gone through the change?
That's a lovely question. So this is the kind of question I'd actually like. So 52 years old, but you have a Mirena coil in, and we know that the Mirena coil itself can stop you from having periods. So the Mirena coil can stay in situ for 5 years, 4 years if we're thinking of using it with HRT, but it can stay in there for 5 years. So I would say just keep it in there. Keep it in there for a good 4 years. If you're having menopausal symptoms, then you can consider adding estrogen to that. But there's no way of really knowing because you've got the Mirena coil in, but I would keep it in. And you're also lucky that it's caused you to have no periods. Some women on the Mirena coil bleed on and off. So I would say that's a blessing in disguise. Well done.
Okay, and I think there's a last question, and I think then we'll hand over to Percy. It says here, I may have missed this, but I heard Black women are more likely to go through the menopause earlier and to be in the menopause longer. So
You
firstly,
know what? Yeah,
true.
I heard that. Yeah. I think it's to do with our BMI as well. Let's be honest, we tend to be on the larger side, don't we? So we will tend to start our periods earlier. Most of the so the larger the girl, the earlier they start with the periods, and the earlier they start with the menopause sometimes. So yes, it could be due to the fact that we are larger women. Yeah.
Yeah.
And also, I find that Black women are not too happy to start HRT. I don't see many. I do see a few, but I don't see many people looking like me on HRT. I've seen masses of Caucasian women. They can't take it enough, but our Black women are still lagging behind.
And I suppose a last very practical question. How do you manage the symptoms of a hot flush when you're in a meeting?
Oh, yeah. So that's why lots of women leave, because all of a sudden they start to sweat. And some people might think they're sweating because they're being dishonest, or, it's a strange situation. That's why I said, have a fan in, get in there before your hand, put a fan on you so you know, wear layers. So when you're having a hot flush, all you need to do is take off your cardigan or take off your jacket, but you're still wearing some clothes, you're not taking everything off and becoming naked. I don't advise that at all. Have a glass of cold water that can help you cool you from the inside out as well. And it depends on your team as well. If you've got a good team, then you can just say, "Oh, I'm having a hot flush," and it'll be banter. But it depends on your team. Don't just say it if you're in a high pressured meeting. But yeah, it all depends on your team. It's a challenge, but I've got to say it's a challenge.
Fantastic. Thank you so much, Dr. Joyce. This has been very, very informative, very comprehensive. And I'm going to be sharing this YouTube with the women in my life. So thank you very much. And on that note of women, I want to remind everybody that next Friday is International Women's Health Day. And Khan is inviting you to the Womb, Health and Wealth meeting. I believe the flyer is in the chat. So please, 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 next Friday, it's in the Emirates Old Trafford Lancashire Cricket Club. There's conferences and workshop from 1 o'clock, networking and dinner from 4:30, and a celebration of women from 6 till 8:30. You might see it, the best brownies in the world there by a company called Blue Strings Bakery. I don't know, something for you to investigate. But thank you very much, Dr. Joyce, and we're going to hand over to Percy.
Thank you so much, Dr. Aya. I mean, just to record everything you said there, really massive thanks, Dr. Joyce. I mean, some of the things we've covered today has been excellent, really helpful, really, not just for the women as well, but also we, the men as well, really, and how to respond to the ladies around us, really, when they're going through the change, and then obviously how to support them and what should be done. So massive thanks. This is one of those videos that, on YouTube, even after the session, the views will continue to grow and grow. So thank you so much for that. And to Dr. Ayo for being a lovely host as always, really. So thanks so much for sparing your Saturday morning, really, and then coming to host the program. It's been truly educative and brilliant as well. So just a couple updates from the CAN team, really. My colleague would be bringing up the slide shortly, but similarly, please join us next week Saturday as well, where we would have another topic as well that I'll be bringing to you. So please do endeavor to join in. I mean, it will be another brilliant doctor as well presenting to you, a lovely host as well. So please do endeavor to tune in. So every Tuesdays as well, we've got our Healthy Hearts program. So please do join that. That's on diet, nutrition. I mean, it was mentioned today as well, really, how much those lifestyle changes, adjustments are really needed, and making sure we're eating healthy. So please do endeavor to join the Healthy Hearts session. And I think just like Dr. I already mentioned, we've got the International Women's Day So that would be on the 8th of March at the Lancashire Cricket Club. If not for anything, be there for the Brownies, like Dr. Aya said. He said it's the best in Manchester. So do make sure you attend that really. Combination of different
I said
conferences.
best in the country.
Best in the country. I was even saying Manchester. So you see,
Yeah.
my hands are up, best in the country and maybe the world as well. So thanks so much, Dr. Aye, for that. So please do make sure you join us on that day. It's on the 8th of March. We'll be covering different things. This year, the focus is on womb health and wealth. Last year, I tried the focus was on menopause, which was a very brilliant one as well, really. So please do make sure you join that. Then on to the next one. So just a couple programs as well, which we've got at the moment. So there's the campaign on long health check. So we may have seen some letters coming through our doors and all that, especially for colleagues who are in North Central London. So please do make sure you respond to those letters and all that. It's screening and all the very useful for ourselves, really, especially for the elderly amongst us. So do make sure you respond to some of those letters and then you're engaging with your GPs, really. Then the next one is really just another program that we've got at the moment. So yes, this is running in Manchester. It's targeted at the Caribbean community. It's all about screening for blood pressure and then your heart health as well. So do make sure you reach out to the contacts on there. If you have a group, an organization, and all that, we're happy to come into your space, run some of those health talks with yourselves, run some screenings as well, really. So do please make sure you engage with the program. It's there for everyone. You can see the areas where the teams will be visiting. So you can feel free to ring the numbers and ask them when they're coming around to your patch. So Ardwick, Longside, Openshaw, and some other areas in Manchester. So do please make sure you're engaging with the program, really. And then just a couple more. So we've got the Black Health Inequality Summit. I think that's the next one. So that's on the 25th of March at the Royal Society of Medicine. It's already a packed event, well oversubscribed. So we're obviously looking for a way to make sure that everyone still has access to some of the outputs that will come out from the summit, like the materials and some recordings. So do please make sure you're following our program channel. So it's called the London Inspire program. So do make sure you're following the program on Twitter, on Facebook, and then also the website as well has lots of resources when it comes to Black health. So do please make sure you're engaging with that. On that note, just to say massive thanks really for everyone who has joined the call today. Really, it's been brilliant. It's been another lovely Saturday morning. We had brilliant presentation, brilliant questions as well, really, and brilliant responses to them. So thank you so much for taking your time to attend this and best wishes for the rest of the weekend. Bye, everyone.